welcome to a special lecture course on protecting yourself from COVID-19 and the workplace. I'm Dr. Pervez Ahmed. This is lecture number 4, and this lectures we will have a discussion on the healthcare settings, long-term nursing and resident care, emergency services, healthcare facility identifications and isolations, a role of public health officials. So let's proceed towards today's lecture. In the first case, we will discuss about the healthcare settings. And for that, we have to refer to the CDC and State Health Department guidelines for protections of the healthcare workers. And the current and the past coronavirus outbreak, healthcare workers have had a high rate of infections. It is especially important to ensure that the procedures, equipment, and training are fully protective. So the detail you can get on the website is just given right in front of you and the blue lines. You can get and you can have all the detail on the CDC. Then the CDC side included guidelines for infections controls, EMS, home care, long-term care, clinical care, evaluating person under investigations, and more. Long-term nursing and residence care. There have been a very large number of COVID-19 cases among resident care workers because of the high prevalence and severity of cases of resident and long-term care. Many agencies have guidelines for long-term care, nursing homes, assisted living facilities, and other resident care facilities. Emergency services that can be maintained consist of the services and critical infrastructures that must be able to function during a national emergency. Emergency services and critical infrastructures that is essentials. Any government or any agency that will want to have a smooth operations, it include law enforcement, fire and EMS, hospitals, public utilities. These are all the emergency services facility that every nations or every government agencies want to have a normal operations whenever they have any sorts of the emergencies. Healthcare facility identifications and isolations. The most important step to prevent spread of COVID-19 are the procedures for rapid identifications and isolation of suspect COVID-19 cases. Community and hospital procedure to ensure symptomatic people are not in public places, waiting rooms, reception areas, emergency department, or other common areas. Collect a travel history for the patients presenting with fewer cog or shortness of breath. Immediately isolate using standard contact and droplet procedure for the suspect or confirmed cases. So community workplaces connections. When a community outbreak occurs, any workplace or even locations where people gather has a high potential for exposures. Example of work settings including schools, sports and art events, social services, a high density of co-workers, high contact with the general public including retail and grocery stores. Example of job activities consist of classroom instructions, adding clients, and serving customers. Critical infrastructures, keeping critical infrastructures and key resources operating is a priority that consists of the government facilities, dams, commercial facilities, nuclear power plants, food and agriculture, public health, healthcare, banking and finance, chemical manufacturing and storage facility, defense and industrial base, water, energy, emergency services and information technology, telecommunications, postal and shipping, transportations, community of operations. All businesses and agencies should have a strategy to overcome potential disruption to operation for maintaining the critical utilities and infrastructures, restoring personnel with authority and knowledge of functions, policies that enable employee to work remotely, communication with employees and customer including during disruption to usual services, stockpiling suppliers are developing multiple suppliers and even of supply chain disruptions, So the roles of the public health officials, that is cases reported by the employer to local health department to do contact tracing, investigate contact of worker who is impacted to determine what other cases may be present and to identify potential source, case identifications and containment, communications and educations. Mitigations may include restrictions of public events and gatherings, transportations, and other activities. Promote physical and social distancing and other safety and health measurements. So this all we have for this lecture. Please stay tuned with the next lecture, because in the next lectures we will have discussions on the key step for preparing for and managing epidemic in the workplace. Community spread can impact any place. Consider the impact on the worker, basic hygiene and social distancing, protecting workers. That will be the key point in the coming lecture. So stay tuned and the coming lecture. Till then, bye bye.